Now, many may ask why I leave the wound open, instead of closing the wound, which is a conservative method. You see, if the wound is dry, I would prefer to actually leave it open. It again depends on where the wound is situated. If the wound is situated at a place where there's a lot of friction with, the bed or the chair, then I will keep it dry. But if it is not, then I will leave it open because there's no oozing. It is very dry, easy to do dressing. It's just spray twice a day, and you can actually see it healing. The other thing is, I also feel that exposing it outside to atmospheric air, the healing seemed to be faster. And that is why I think I would like to promote this kind of management.